Digestive issues, you might know what that's all about. They can be unpleasant and embarrassing, but by having this conversation so openly here, you might feel more comfortable talking to your doctor, especially if what you're dealing with is treatable. Dr. Phil Hart is here to help with that. Good morning, Dr. Hart.
Hi, Mary. Thanks for having me on the show.
It's a pleasure to see you. What are some of the most common GI issues and symptoms that many people face?
Yeah, you're right. 60 to 70 million people in the United States suffer from some type of GI symptom. And there's a wide range of these symptoms. These include things like abdominal bloating, gas, or change in their bowel patterns.
Why are people hesitant to share concerns with the healthcare professionals in their lives?
So we recently completed a survey through the American Gastroenterological Association. One of the most striking findings from this survey was that patients waited on average 4 years before discussing their GI symptoms with their healthcare provider. And of those patients that felt that they had a difficult time discussing their symptoms, 60% cited embarrassment as the primary factor for that.
Wow. That's sad to me because 4 years is a long time to be,
That's
uncomfortable
right.
at best, in pain for a lot of people. So I see EPI over your shoulder. What is EPI and why is it often hard to diagnose?
Yes, so EPI stands for exocrine pancreatic insufficiency, and this is a highly treatable condition that can result in these types of GI symptoms that we just discussed. In its most severe forms, these symptoms would include things like greasy stools or unexplained weight loss. But the milder forms of EPI can produce symptoms like abdominal bloating or gas. And these symptoms are very common and overlap with other GI conditions. And it's because of that overlap in symptoms that diagnosing it can be very challenging.
So what can patients do to take a more proactive role in their health?
Yeah, again, this 4-year delay in starting the conversation we think is unnecessary. We would first encourage patients to have an open conversation with any of these GI symptoms that they might be having with their healthcare provider. It's clearly the case that not all of these symptoms represent severe diseases, but as with the case in EPI, there are many conditions that may produce these symptoms that are highly treatable.
So is there a website where maybe our viewers can go to get a little bit more comfortable with the idea about talking to their doctor about it once they get some more facts?
Sure, yeah, for anybody that's interested, they can visit identifyepi.com or gastro.org for more information.
And you know, we've talked on the show, Dr. Hart, about other conditions and concerns health-wise. And something I've heard from people is, listen, we've heard it all. As doctors, it's not like patients are going to come in and tell you something that you're not familiar with or that you haven't heard before. And to me as a patient, that gives me a sense of peace about it. Is that fair?
That's absolutely correct. These are conversations that we have patients with on a daily basis. And again, we feel that it's just really unfortunate that many of these patients have to suffer in silence.
Well, listen, as I started the conversation, I said, we're putting it out there today with the hopes that our viewers will feel like, okay, if they're talking about it on TV, it's okay for me to talk about it with my doctor. Dr. Phil Hart, thank you for joining us today.
All right. Thanks, Mary. Appreciate it.
Mike, we'll send it over to you.